How's it going, folks? Happy Wednesday. Can you guys hear me okay? All right, welcome back. It is 12:01. Let's get started. You guys, any questions, any doubts, any concerns, anything at all? We're doing all right? Do we all know that our first exam is coming up in 2 weeks? So we are 2 weeks away from our first lab exam, okay? And today we have a very, very important lab. And the reason for that is because today we are going to cover half of the exam. Remember, the first exam is going to be on the skeletal system, naming of bones, naming of bone markings, and it's going to be on skeletal muscle, naming of muscles. Okay, so today we're going to cover half of the exam, and then next week, Wednesday, we're going to cover the other half of the exam. And then the week after that, we're going to have the exam. All right. Keeping in mind that the exam is closed book and that you need to have your camera on in order to take the exam. You also don't have the entire class period. You have 70 minutes, 1 hour and 10 minutes to take the exam. Okay. Now, you all know, hopefully, that we do have an exam list. You do have a study guide for every single one of the exams, and you have that since the first day of class. And the study guide is what you're going to be responsible for in the exam. If it is a bone or a muscle or a bone marking that is not listed in that exam list, you're not responsible for it. If it is in the exam list, then you are responsible for it. Also remember that the lab exams, they are just questions about the anatomy. There is no physiology question, no questions about function, no question about insertion of muscle, about action of a muscle, no physiology question. It's just anatomy questions. Everybody started to study for the exam, right? You can lie. Well, I'm going to give you guys a ton of clues today. Excuse me, how to answer the questions, what you need to know. Really going to try to narrow things down for you. And then I want to make sure that you guys participate. We're going to do some practice for the exam today. So help me out when I ask you a question, because it's much better for you to get it wrong today than getting it wrong on the day of the exam. You can get wrong today. That's okay. That's fine. But that's not going to be a problem if you get it wrong on the day of the exam. Okay. So let's just participate and engage in the classroom. All right. So let me share my screen with you. Okay, folks. So today we're actually covering more than one lab. We're covering two labs today. And you knew that because you looked at the course schedule and you had two pre-lab assignments to turn in. So we're going to talk about lab 4 and lab 5. And I'm going to go very quickly through lab 4. And the reason for that is because I already covered this in the lecture. So if you are taking my lecture, this is something you've already seen. And we are not going to see this in the lab exam. So I want to rush through it so that we can get to the bones, we can get to the skeletal system and spend most of the time today naming bones and naming bone markings. Okay? We do know that we have four different types of tissues in the body. And those tissues, they're going to make every single organ and structure in our body. And those tissues are the epithelial, connective, muscular, and nervous. The epithelial tissue is the tissue that covers both the outside of our body as well as the inside of our body. The epithelial tissue is avascular, it doesn't have any blood vessel, and is classified based on the shape of the cell and the number of cells, the layer of cells on top of each other. If the cell looks like a flat pancake, it's going to call it squamous. If it looks like a cube, it's called cuboidal. And if it looks like a column, it's called columnar. If we have a single layer of cell, we call it simple. If we have several layers, we call it stratified. And we also have what is called a pseudo-stratified. And pseudo means not really, fake. So it's not really stratified. It looks like it's stratified, but it's not. Okay, now in order to name a tissue, you need to combine both of the information. So for example, this tissue right here would be simple cuboidal. This one right here would be stratified cuboidal. This one right here would be simple squamous. This one right here is pseudo-stratified columnar. All right. Now, connective tissue, like the name implies, connect and keep things together in our body. And we have 6 different types of connective tissues, and they share a couple of things among the 6. They share the fact that most of them has a special cell called a fibroblast that produces several different proteins and extracellular matrix. Okay. Now, what are the 6 different types of connective tissues? We have bone, cartilage, tendons, adipose, areolar, and blood. Right? And again, we talked about this before in the lecture. Moving on to the muscular tissue, we know that we have 3 different types of muscular tissue. We have what we call the skeletal, which is attached to the skeletal system, which, by the way, folks, this is the one that we're going to be covering in the first exam. Okay, naming of skeletal muscles. Now, we also have cardiac muscle, and we have what is called the smooth muscle. Out of the 3, only the skeletal is voluntary. It's the only one that we can control. The other 2 are involuntary. And out of the 3, the smooth muscle is the only one that doesn't have striations. We do find striations both in the cardiac and the skeletal. Now, the only thing that I want you to know at this moment about the nervous tissue is that the most common and the most important cell in the nervous tissue is what we call a neuron. And we can see a little neuron here on the screen, okay? Do not confuse the name of the tissue with the name of the cell. The tissue is called nervous. The cell, the most common cell, is called a neuron. Okay, it is not the neuron tissue, it is the nervous tissue. All right, so that's it for lab 4. Now let's move into lab 5. And lab 5 not only talks about the skeletal system, but also combines the integumentary system, which again, I'm going to go very, very quickly through it because you are not responsible for it in the lab exam. We do know that we have 3 different layers of skin. We have a thick layer in the middle called the dermis, which contains blood vessels, nerves, muscles, hair follicle, etc. There's a layer on top called the epidermis and a layer at the bottom called the hypodermis, aka the subcutaneous layer. Now, the epidermis itself has several different layers. We have what we call the stratum basal, the stratum spinosum, granulosum, lucidum, and corneum. The epidermal layer is avascular, and we do find 2 different layers in our body. We have a thin skin layer and a thick skin layer of the epidermis. Most of our body only has 4 layers of the epidermis, only the basal, spinosum, granulosum, and corneum. But in the palms of our hands and the sole of our feet, we're going to find 1 extra layer for protection. And that extra layer is what we call the stratum lucidum. Okay. Now, we do have several different accessory structures to the skin, including glands, hair follicles, and nail. There are two different types of cutaneous glands found embedded in the skin. We have the sebaceous glands, also called the oil gland, and we have the sudoriferous glands, also called the sweat glands. The sebaceous gland, they produce sebum or oil, and that oil helps to create a layer that will prevent water from passing and getting lost into the environment. So it prevents the desiccation of our skin. It helps the skin to stay moist. The sudoriferous glands, they make sweat, and sweat helps with the control of our body temperature and also helps with the prevention of growth of bacteria because it creates a hypertonic environment. Okay. The hair, also called the pili, is made of different sections. The section of the hair that is poking outside of the skin is called the hair shaft. Then we have a hair root, and all the way at the bottom of the root, we have what is called the hair bulb. Okay, and within the hair bulb, we are going to find what is called the hair matrix right here. And this hair matrix, they help with the growth of our hair. In the hair matrix, we're going to find stem cells that are constantly dividing. And as they divide, they allow the hair to grow from the bulb towards the tip. Every single hair follicle in our body has a tiny little smooth muscle attached to it. And that smooth muscle is what we call the erector pili. And this erector pili gives us our goosebump or chicken skin sensation when we are scared. And the nails also have different sections. The section of the nail that pokes beyond the fingertip is what we call the free edge, right here. The main section of the nail is what we call the nail body. And all the way at the bottom of the nail body, we're going to find a little white section called the lunula. And then all the way at the bottom, we have what we don't see. We have what is called the nail root, okay? And surrounding this nail root, we also find a layer of stem cells, which forms what we call the nail matrix. And the nail matrix is what allows our nails to grow. Because again, we have a lot of stem cells constantly dividing, right? And we have a little section of skin and tissue right here that helps you anchor the nail to the finger. And that is what we call the eponychium or simply the cuticle. All right. So if you're sleeping up to this point, now is a good time to wake up. We are going to study for half of the exam. Okay? Now, when you look at a little cartoon like what I have here of the skeletal system, we can see that not all bones are created the same. There's a variety of sizes and shapes and densities and functions of bones. Some bones are classified as long bones, like the humerus, the radius, the ulna, the femur, the tibia, the fibula. Some of them are classified as flat, like the bones of the skull, like the bones of the sternum, like the bones of the ribs. Some of them are classified as short, like the bones of our wrist that are called the carpals, like the bones of our ankle called the tarsos. And some bones are classified as irregular because they have a weird shape to them. And that includes the bones of the vertebral column and also the hip bones. Okay? Now, the skeletal system does not include just bones. The skeletal system also includes cartilage at the end of the bones to help with articulation of one bone against the other. We have joints that allows us to move our body. Without the joints, we couldn't have motion, we couldn't have movement. And ligaments help to attach a bone to another bone. Okay, so it is what helps you connect bone to bone at a joint. We can divide the skeletal system into two main family of bones. we have what we call the axial skeleton, and we have what is called the appendicular skeleton. That is basically attached to the axial skeleton. So let's see what are the bones that makes the axial skeleton family. What are the bones that makes the appendicular skeleton family? And then from this point on, we're going to go into more detail and take a closer look at those bones and the markings on those bones. So the axial skeleton is made of the skull, and the skull itself is divided into the bones of the cranium and the bones of the face, what are called the facial bones. Then we have the thoracic cage, and the thoracic cage includes the sternum and also includes our ribs. And we have the vertebral column, and the vertebral column includes the vertebra and also includes the sacrum with the little coccyx at the end. Okay, so these are the bones that belong to the axial skeleton. Then we have the bones of the appendicular skeleton, starting from superior to inferior. Right here on our shoulder, we have a group of bones that belong to what we call the pectoral girdle, also called the shoulder girdle. And those bones includes the clavicle and includes the scapula. And then moving up to the upper limb, on the upper limb, we're going to find the humerus. And then in the forearm, we're going to find the ulna and the radius. We can see how when an individual is standing in an anatomical position, a standard anatomical position, the ulna has a medial aspect, while the radius has a lateral aspect. What's going to happen, though, if I take my hands, which are facing forward, and I turn it down like this? We can see right here that when this happens, the ulna and the radius will cross each other. They're not going to be parallel anymore. Okay, so that is important to keep in mind. So we are going to be looking at an individual always in standard anatomical position, in which those bones are parallel. Moving on now to the hands, and the hands are made of different groups of bones. We have the carpals, which are the bones of our wrist. We have the metacarpals, which are the bones of the palms of our hands. And we have the phalanges, which are the bones of our fingers. And we're going to talk about each one of them and how to name them. Moving down now to the hip. In the hip, we have what we call the hip girdle or pelvic girdle. And the pelvic girdle includes two bones. And we can simply call them hip bones. So we have the left hip bone, and we have the right hip bone. And we're going to see there are important markings of the hip bones that I want you guys to know for the exam. We're going to name them. Moving on to the lower limb. In the lower limb, we have the femur, which is the biggest, heaviest, and longest bone that we have in our body. We have a little sesamoid-shaped bone in the front of our knee joint, protecting the knee joint, and that's what we call the patella. And then we have two bones parallel to each other in the lower leg, just like we have in the forearm, and those are what we call the tibia and the fibula. Again, excuse me, I want you to notice here that the tibia has a medial aspect, while the fibula has a lateral aspect. Okay. Moving on now to the foot, and the foot is also made of different groups of bones. We have the bones of the ankle that we call the tarsos. We have the bones of the sole of our feet, which are called the metatarsals. And then the bones of the toes are also called the phalanges, just like the bones of the hands. Okay? All right. Now, before we get to name the bones and the bone markings, let me spend a couple of minutes here explaining what a marking is. Once again, if you have started to study, if you have looked at the exam list, you know that there are name of bones and bone markings that you need to know for the exam. What are these markings? Guys, markings are specific features of a bone. And those features of the bone, they are there for a purpose. They are not there because they look cool. They are there because they perform a function. And those markings could be a hole through a bone. It could be a marking like a groove through a bone. It could be a channel through a bone. It could be a bump on a bone. So those markings have a function. Now, you don't need to know those functions for the exam, but you need to be able to name the markings of certain bones. Okay? Now let's take a look at the skull here as an example, and let's take a look at some general markings that we can find in the body. And we're going to find these markings all over the skeletal system. One of those markings is what we call a groove. And we can see a groove right here on the body of the mandible on both sides. And a groove is like a furrow, like an indentation in which blood vessels are going to be running right next to it, neatly packed inside of that furrow. Okay? Then we have what is called a fissure. And a fissure is an opening through a bone that looks like a slit. Kind of look like this, a little slit, narrow. We have two important fissures inside the orbital space. We have what we call the inferior orbital fissure, and we have the superior orbital fissure. And in this inferior and superior orbital fissure, we're going to have the passage of blood vessels. We're going to have the passage of the optic nerve, for example, that is sending information from the eye to the visual cortex of the brain. There's another type of opening through a bone that is called a foramen. And we're going to see a lot of foramens today. And a foramen, different from a fissure, the foramen is round or oval. That is the difference between the two, the shape of them. Okay? Then we have a notch, and a notch is the indentation at the edge of a bone. A meatus, different from a fissure and a foramen, which is just an opening, just a hole. A meatus is actually a channel, a little canal, a little channel through a bone. Okay, that's going to allow, again, blood vessels and nerves to pass right through it. We have a very important meatus right here in our ear that is called the external acoustic meatus, or the external auditory meatus. In the facial bones, we have something called a sinus, and a sinus is a cavity filled with air in which the walls of the cavity is covered with the mucous membrane. And then there's something called a fossa, and a fossa is a basin-like depression on a bone, oftentimes serving as a point of articulation between two bones. What is articulation, folks? Articulation is where two bones touch each other. Okay? When they touch each other, they articulate. All right. Let's start naming bones and bone markings, so we understand what we need to do for the exam. Let's start with the cranium bones first, and then we're going to talk about some of the facial bones. Okay? And the first bone I want to talk about is this big plate of bone right in our forehead. This is what we call the frontal bone. If today was the exam and I was pointing to this bone here and asking you to name this bone, you would simply type down frontal. You don't even need to put bone. You can if you want to. It's not going to hurt you. But you can simply say frontal. That's it. You got a full point for the question. Moving more posteriorly, we're going to find now two plates of bone on the top of the head. And those are what we call the parietal bones. And the parietal bones, different from the frontal, they are bilateral. I want to say this again because this is a huge pain point in the exams. I need everybody's attention. Every time that you have a bilateral structure, automatically, you don't need to be asked, automatically you need to tell me if I'm pointing to the right or if I'm pointing to the left. Every time, folks. Okay? So the parietal bone here, let's say today was the exam and I was using this cartoon here, which I'm not going to be using in the exam. In the exam, I'm going to be using pictures of models like the ones you're going to be watching on the Edpuzzle video today for the in-lab activity. But if I was using this, how would I name this here for the exam to get the full points? I would say right parietal. That's it. If I was pointing to the other one, that would be left parietal. No secrets. Okay? Moving down to the base of the skull, we have another big plate of bone, which is single bone, that we call the occipital bone. And there are some markings of the occipital bone that I'm going to be talking more about in a little bit. And then to the side of the skull, we're going to find what we call the temporal bone. Again, we have the right temporal, we have the left temporal. Now, let me make a pause on the temporal bone. And I want to show you several important markings of the temporal bone that I love asking questions about it in the exam. One of those markings is a bridge that connects the temporal bone with what we call the zygomatic bone. You know, what we call the cheekbone right here in the front, this is the zygomatic bone. So we have the right zygomatic, we have the left zygomatic. And connecting the temporal with the zygomatic, there is a bridge. And this bridge right here is a marking of the temporal bone. And this marking is what we call the zygomatic process of the temporal bone. Okay, now let's say today was the exam and I was pointing to this marking right here. How would you answer that to be correct? You would say zygomatic process, right temporal. And the point I'm trying to make here, and I need everybody's attention so you don't make this mistake in the exam, which happens all the time. My point is, every time that I ask for the name of a bone marking, you also, it is required, you need to tell me the name of the bone which the marking belongs to. I'm going to repeat that. Every time that I ask for a name of a bone marking, you also need to give me the name of the bone that the marking belongs to. No marking exists on itself. A marking exists on a bone. Okay, so we have the zygomatic process, right temporal. We have the zygomatic process, left temporal. Some other markings here that I like to ask questions in the exam. We have this meatus right here. And remember, a meatus is a channel. And this is what we call the external acoustic or external auditory meatus. Acoustic or auditory, it means the same thing. So if I was pointing to this one on the exam, this would be external auditory meatus, right temporal. Another marking right here, which is this needle-like structure, this is what we call the styloid process, right temporal. Okay, so always the name of the bone marking and the name of the bone. Is this clear, folks? Any questions at all up to so far? Nothing. Okay. There's something else I want to mention that is very important. When you have the 25, so there's going to be 25 questions for bone and 25 questions for muscle, right? Within the 25 questions for bone, some of the questions, they're going to say bone name only. And this is going to be included in the question. You're going to be able to see that in the question of the exam, okay? If it is a question that asks you for bone name only, that means I'm only asking for the name of the bone. You know, frontal bone, right parietal, left parietal, occipital. If it is a question that says bone marking, that means not only I'm asking you for the name of the bone marking, but also the name of the bone as well. If you just give me the name of the bone marking, I'm going to give you partial points for that. But if you just give me the name of the bone without the marking for the bone marking questions, you will get 0 points for the question. Okay, I want you to remember this so that not later on you come back to me after I grade the exam and say, hey, professor, I named this bone correct. Why I didn't get any points for it? Because you didn't give me the name of the bone marking as I asked on the question. Okay, so please pay extra attention. And you're not going to have to guess because that information is going to be given to you on the exam. Moving on, let's take a closer look at some of the other bones here of the skull. We have this bone right here. We can't see very well. We're going to see it much better in another VIL. And there's an important marking of this bone that I want to talk about. But this is what I call the sphenoid bone. And it is a single bone as well. By the way, I do have a slide here in the presentation that tells you if these bones of the cranium, if they are single or if they are double. So again, you don't have to guess. Looking inside the orbital space, we're going to find a couple of bones in there. We can see the ethmoid bone, and we can also see the lacrimal bone. Then on top of our nose, we have what we call the nasal bone. And we understand that the nasal bone ends right there at the top because the tip of our nose is made of cartilage. Holding our upper teeth, we're going to find the maxilla, and the maxilla is bilateral. There's actually two maxilla. We're going to be able to see there's a line dividing the right and the left maxilla. And then we have the strongest bone in our, what we call the mandible. Do not confuse mandible with maxilla. Okay, and different from the maxilla, the mandible is one single bone. So there is no right or left mandible. And that brings me to the name of this marking right here on the mandible. This is a foramen called a mental foramen. And we have two of them. We have a right mental foramen of the mandible, and we have the left mental foramen of the mandible. I have a question for you guys. Can I say, if I was pointing to this one right here, can I say, oh, this is the mental foramen of the right mandible? Would that be correct to say? Yes, no, and give me the reason. Yeah. Yes, it is correct. Anybody has a different opinion? Again, I said mental foramen, right mandible. I have another here. No, because there is only one mandible. Absolutely, it is not correct. Because when I say mental foramen of the right mandible, I am implying that there are two mandibles, and there is no two mandible. There is a single mandible. So instead, I have to say right mental foramen of the mandible, left mental foramen of the mandible. I hope you can see the difference. Any questions, folks? All right. All right, now we have another view of the skull, and we're going to take a couple of different views of the skull. And this veil here is a superior veil with the top of the cranium removed. And what I want you guys to focus right now, folks, I want you to focus on this big, beautiful bone right here. Looks like a butterfly. And this is what we call the sphenoid bone. And as we can see right here, it is a single bone. And there is a very important marking that I want you guys to know. I love asking questions about it in the exam. And that marking is what we call the sella turcica. Sella turcica literally means Turkish chair. So this is a little chair inside our cranium. Do you know what's going to sit inside of this little chair? The pituitary gland is going to be sitting right there in the sella turcica. Okay, and the pituitary gland is what we call the master endocrine gland. It is the most important gland that is going to control many other organs and glands in our body. So what if I was asking you today's exam, and I'm pointing to this bone marking here and saying, hey guys, give me the name of this bone marking. How would you answer that to be correct? You would say sella turcica sphenoid. You gave me the name of the marking. You gave me the name of the bone that the marking belongs to. Okay? A couple of other markings I want you guys to know. We can see right here, this is what we call the jugular foramen. By the way, guys, just for sake of clarity, foramen is singular, foramina is plural. Okay? If you have more than one, is a foramina. If it's one, is a foramen. And this jugular foramen here, it belongs to the temporal bone. So if I was pointing to this guy right here, this would be the jugular foramen right temporal. This one would be the jugular foramen left temporal. Looking all the way back here at the base of the skull, again, we can see the big occipital bone in brown here. And the occipital bone has this huge, massive foramen right there. This is what we call the foramen magnum. Magnum means big, large. So this is a large oval hole through the occipital bone in which our spinal cord is going to pass right through this hole. So what if I was asking the name of this bone marking right here on the exam? You would say foramen magnum occipital. Foramen magnum occipital. Let's take another view of the cranium. And now we have an inferior view of the cranium with the mandible removed out of the way. And I want everybody to take a look right here, folks. We can see that the maxilla extend inside of the roof of our mouth, inside the oral cavity. And we can see this line right here, right in the middle, separating the two maxilla, the right maxilla from the left maxilla. And in the roof of our mouth, there is some grooves right here on the maxilla. And these grooves are markings of the maxilla that we call the palatine process. Okay, so I want you guys to help me out here. Let's say that today's exam and I'm pointing to this bone marking right here. Go ahead and name it for me. Let's practice, guys. Let's see here. There's something missing. Palatine process, right? There you go. Okay, so this is the palatine process, right maxilla. Because again, the maxilla is bilateral. We have the right and we have the left. Okay. Moving on, still on the roof of our mouth, now more towards the back of the oral cavity, we're going to find another plate of bone that also makes up the roof of the mouth, all the way in the back. And this is what we call the palatine bone, right here. And guys, don't confuse palatine bone with palatine process of the maxilla. Two different things. It's just like the zygomatic bone and the zygomatic process of the temporal. Okay? All right, taking a look now at the temporal again, we can see once again the jugular foramen, and there's also another foramen that I want you guys to know, which is the carotid foramen right here, which also belongs to the temporal bone, and it is bilateral, right and left. All right, back at the occipital bone, all the way here in the back of the skull, we already talked about the foramen magnum. Now I want to talk about another marking that I love asking questions in the exam. And those markings are these flat surfaces right here to the side of the foramen magnum. These markings are called the occipital condyle. Okay, so, and we have two of them. We have the left occipital condyle of the occipital, and we have the right occipital condyle of the occipital bone. Again, it is not occipital condyle of the left occipital because we only have one occipital bone. Okay? Any questions, guys? And finally, an anterior view of the cranium, the skull, and the facial bones. And what I want to focus here on this view, I want to focus inside the nasal cavity right here. And inside of the nasal cavity, we can take a look at a couple of different markings here. One of them is what we call the middle nasal conchae. And this middle nasal conchae, they do belong, these are markings of the ethmoid bone. Okay, and they are two. We have the right and we have the left middle nasal conchae. And then we also have the perpendicular plate. And the perpendicular plate is a wall that separates the two nasal cavities, the top of the wall. And this is what we call the perpendicular plate of the ethmoid bone. And then at the bottom of the nasal cavity, we have another bone that is going to make the floor of the nasal cavity. And this bone is what we call the vomer. Right? This bone right here is the vomer. And as promised, here we have it, folks. This is the list of 8 cranial bones and 14 facial bones. If you see a 1 in front of the name of the bone, that means there is only one single plate, like the frontal, like the occipital. If you see a 2 in front of it, that means there are 2, like the parietal, like the temporal, like the spheno, like the maxilla, like the nasal bones, etc. Okay, guys, does anybody have any questions? All right, moving on. I want to talk very briefly here about this big bone that we have. Most people don't even know we have this bone. Is what we call the hyoid bone, also called the antisocial bone. Why is it called the antisocial? It is called the antisocial because it does not articulate with any other bone in the skull. What does articulation mean, folks? Articulation means touch, physically touch. So how does the hyoid bone stays in place? The hyoid bone stays in place by long ligaments that is going to attach the hyoid to other structures within the skull. Okay, and the function of the hyoid bone is that it serves as a basement to support our tongue. So our tongue sits right on top of the hyoid bone. You don't need to worry about any of the markings of the hyoid, just to know the name of the bone. Moving on to the vertebral column, good news. you don't need to know individual name of a vertebra. Now, it's a good idea to know that the vertebral column is divided into different sections, different curvatures. The first 7 vertebrae, which are the vertebrae of our neck, these are what we call the cervical vertebrae or the cervical curvature. And it goes from C1 all the way to C7. The next 12 belongs to the thoracic curvature. The next 5 belongs to the lumbar. Then we have some fused vertebrae that makes up the sacrum. And then all the way at the bottom, we have another small fused vertebra that forms the coccyx. But you don't need to know individual name of vertebra. And you know that because they are not listed in the exam list. Moving on to the thoracic cage, another good news, you don't need to know individual name of the ribs. Now, the ribs, have numbers. They don't have names. They are numbered from 1 all the way at the top here through 12 all the way at the bottom. Okay? Now, there are some markings of the ribs, and we're going to focus specifically on what we call the true ribs. And what are the true ribs? The true ribs are the ones that are directly attached to the sternum by this piece of cartilage right here called the costal cartilage. But again, they are numbered from 1 all the way through 12. Not that you need to know their numbers. Now, what about the sternum? Everybody look up here, please. The sternum has 3 markings that I like to ask questions on the exam. One of the markings on top of the sternum right here, this big section is what we call the manubrium of the sternum. Then the main section of the sternum is what we call the body, also called the shaft of the sternum. And then all the way at the bottom of the sternum, we're going to have a little piece of cartilage that is called the xiphoid process of the sternum. So once again, all of these are markings of the sternum. So if I'm pointing to this one here in the exam, guys, it is not enough just to say manubrium. You need to tell me manubrium, sternum, body, sternum, xiphoid process, sternum. Okay, they are markings of the sternum. So let's take a look at some of the markings of a rib, a true rib. And again, we're looking at a true rib right here. You don't need to worry about right and left in regards to the ribs, just naming the markings and the name of the bone itself. But the rib, they are attached to the vertebral column. And the section of the rib that is attached to the vertebral column is what we call the head of the rib. Every time that you have the head of a bone, folks, and we're going to see this a few times, every time that you have a head of a bone, there's also a neck of that bone. So right after the head, we are going to find the neck of the bone, of the rib, right here. Again, it's not just head, it is not just neck, it is head of rib, neck of rib. And then the ribs are going to make a turn from posterior to anterior. And this turn right here, this is what we call the angle of rib. This is another marking of the rib. Then the main section of the rib is what we call the body or the shaft of the rib. And finally, what is going to connect the true ribs to the sternum right here is a little piece of cartilage that is called costal cartilage of the rib. So again, head of rib, neck of rib, angle of rib, body of rib, and costal cartilage of the rib. All markings of the rib. Any questions? All right, guys, we are done with the axial skeleton. The only thing we have left to do is talk about the bones of the appendicular skeleton. And we are going to start all the way here at the shoulder with what we call the pectoral girdle or the shoulder girdle. And the pectoral girdle is made of two bones, clavicle and scapula. Everybody pay attention here for a second, please. You can see right here in the my presentation, guys, that I'm also putting the common name of the clavicle, which is collarbone, and the common name of the scapula, which is the shoulder blade. For the exam, I don't want the common name of those bones. I don't want you to call it collarbone. I don't want you to call it the shoulder blade. I want the proper nomenclature, the proper scientific name of the bones. If you put in collarbone, you will get 0 points for it. If you put in shoulder blade, you're going to get no points for it. Okay? You have been warned. Another point that I want to make, because I've seen this in the previous exam. So basically, what I'm trying to do, folks, I am trying for you to avoid all the mistakes that I have seen in past exams. If I am pointing to one of these bones right here, you're not going to call them pectoral girdle or shoulder girdle. These are not the name of the bones. This is the name of the group of bones. Okay? Be specific. Now, for the clavicle itself, there's no marking that you need to know for the exam. But of course, the clavicle, we do have two of them. They are bilateral. So we have the right clavicle, we have the left clavicle. Now, taking a look at the scapula, and here we have a posterior and a lateral view of the same scapula. And the scapula here happens to be the right scapula, which you do need to know, right? Because they are bilateral. And the scapula has 3 markings that I love asking questions on the exam. What are those markings? We have the acromion. Let me show you where the acromion is here in this anterior view. So this section right here, that is the acromion right scapula. Then we have the coracoid process. Let me show you where the coracoid process is here in the anterior view. This little section right here. So that is the coracoid process, right scapula. And then we have the surface that is going to attach to the head of the humerus to form our shoulder joint. And that surface is what we call the glenoid cavity of the right scapula. Okay, these are markings of the scapula. Again, acromion of the scapula, coracoid process of the scapula, glenoid cavity of the scapula. And then, of course, right or left. Moving on now to the upper limb, starting with the humerus. And we are looking at 2 views of the same humerus. We have an anterior view and we have a posterior view. Now, the humerus, of course, it is bilateral. And there are several markings, guys, that I will ask you questions in the exam. So let's start from the proximal end of the humerus and then move down to the distal end. In the proximal end, we have what we call the head of the humerus, right here. Can you see this rounded, smooth-looking surface? That is the head of the humerus. It's a marking of the humerus. And the head of the humerus, it is covered in articular cartilage because it's going to articulate with the glenoid cavity of the scapula, forming again our shoulder joint, what we call the ball and socket type of joint. Okay? Remember what I said earlier. Every time that you have a head of a bone, you're also going to have a neck of the bone. Right underneath the head, in the humerus, we're going to find the neck of the humerus right here, what we call the anatomical neck. And the humerus, in fact, has two necks. It has the anatomical neck right underneath the head, and it has what we call the surgical neck right below here in the diaphysis. Okay. Now, why do we call this the surgical neck? This is called the surgical neck, folks, because when people fracture the neck of the humerus, they almost never fracture the anatomical neck. Usually the fracture is in the surgical neck of the humerus, and hence the name surgical neck. All right. Now, right here in the proximal end of the humerus, there are two tubercles that I want you guys to know, two bumps. Everybody look up here. There is one bump here, and there's another bump right there. These bumps have a name, and these bumps, they serve as point of attachment to ligaments and tendons. So we're going to find what we call the greater tubercle, and we have the lesser tubercle. The greater tubercle is lateral. It has a lateral aspect. Okay, moving away from the midline of the body. The lesser tubercle has a medial aspect. That's a good way to remember them. Okay. Looking at the distal end of the humerus now, and in the distal end, there's also several markings that I like to ask questions in the exam. We have a fossa here that we can only view in the anterior view, which is called the coronoid fossa. And then right below the coronoid fossa, we're going to find two other markings which are covered in articular cartilage, and these are the capitulum and the trochlea. Guys, let me show you here. The capitulum is this section here. And then here we have the other end, we're going to find the trochlea. And again, they're both covered in articular cartilage because they're going to form our elbow joint. Let's now look at this humerus on the posterior view from the back. And in the posterior view, we're going to find another fossa called the olecranum fossa. And then to the side of the olecranum fossa, we are going to find the two epicondyles, the medial and the lateral. Take a wild guess why they're called the medial and lateral, folks. The medial epicondyle has a medial aspect. The lateral epicondyle has a lateral aspect. Okay, and these are these bumps right here. We can actually feel them. If you feel here at your elbow joint, you can feel the lateral and the medial epicondyle of the humerus. These are all markings of the humerus. How would we name one of these here on the exam, folks? Let's say that I was pointing to the medial epicondyle. You would say medial epicondyle, right humerus. What if I was pointing to the head? You're going to say head, right humerus. What if I was pointing at the neck? We're going to say anatomical neck, right humerus. Moving on, let's talk about the forearm now. And in the forearm, as I mentioned earlier, we have two bones parallel to each other. We have the ulna and we have the radius. And they are parallel when we stand in standard anatomical position. So here we are looking at the ulna and the radius of the right arm, right there. Let's start with the ulna and take a look at some of the markings right here. One of those markings is this big bump right here on the ulna. This is what we call the olecranum of the ulna. So this would be olecranum, right ulna. And guys, if you touch the tip of your elbow, you are touching the olecranum of the ulna right there. Right underneath the olecranum, we're going to find what is called the trochlear notch. Again, immediately after the olecranum. So this little section right there. And then underneath it, there's a little bump. You can't see it too well here. but there's another little bump that's what we call the coronoid process. Okay, so olecranon, trochlear notch, coronoid process. In the distal end, we're going to find the two markings that I want you guys to know. One belonging to the ulna, the other one belongs to the radius. The one belonging to the radius is what we call the radial styloid process, right here. So on the exam, you can call this right radial styloid process, or you could call it styloid process right radius. The other one, the one on the ulna right here, this little bump right there, this is what we call the styloid process of the ulna, or the ulnar styloid process. So it would be the right ulnar styloid process or styloid process of the right ulna. Okay. All right, guys, moving on to the hands now. And again, the hands are divided into the carpals, metacarpals, and the phalanges. First things first, you need to be able to look at a hand model that is sitting in front of you, just a picture of the model, not going to be attached to the rest of the body. And looking at that, knowing the information that you're looking from the anterior aspect, anterior view, also called the palmar view. And you need to be able to determine if you're looking at the right or the left. As we can see right here, this one would be the right hand. That information is not going to be given to you. You have to figure that out. So I'm going to take this right hand right here. And what I'm going to do, folks, I'm going to flip it upright. Right there. It is the same hand. This is still the right hand that I just flipped upright. Okay, it's still anterior view. It's still what we call the palmar view. Now, good news. You don't need to know any individual name of the carpal bones, and there are a total of 8 carpal bones. You don't need to know any of them. Again, they are not listed in the exam list. What about the metacarpals? Where are the metacarpals, guys? The metacarpals are the bones of the palms of our hands. And they are numbered, very easy, with the number 1 ending at the thumb. Pay attention. I am not saying that the number 1 metacarpal is the thumb. It is not. But the number 1 metacarpal will end at the thumb. So it goes number 1 metacarpal, number 2, 3, 4, and 5. Okay? What if I was pointing to one of these in the exam, folks? And again, you need to be specific. I am not pointing to all of them. I don't want the name of all of them. I want the name of one of them. This would be the 3rd or number 3 right metacarpal. What if I was pointing to this one? The 1st or the number 1 right metacarpal. All right, moving on to the phalanges now, and this one is a little bit more complex. And it's a little bit more complex because the phalanges are split, are divided into little bones. So it's not one single bone. Otherwise, we couldn't bend our fingers. They are actually made of smaller bones. There are 2 smaller bones in our thumb, and there are 3 smaller bones in the other 4 fingers. Now, first of all, the phalanges, the fingers, are numbered as well. So the thumb would be number 1, number 2, number 3, number 4, and number 5. Now, we also need to add the information about the specific bone that I'm pointing to. And the phalanges are divided into what we call the proximal, we have the middle, and we have the distal. However, the thumb only has proximal and distal. Okay, so let's name them here together, folks. What would we call this, if I was pointing on the exam or the quiz, like the one you're going to be taking today, what if I was pointing to this bone right here? And again, you need to be specific. This would be right second proximal phalanx. Now, phalanx is singular, phalange is plural. But if you don't remember that for the exam, that's fine. I'm not going to take points from you if you use plural instead of singular word. But you need to have all the other information. Right second or number two proximal phalanx. I want your help. Everybody look up here, please. Can anybody name this bone right here that I just circled for you? Go ahead. Let's practice, guys. Let's see right here. Right fourth middle phalanx. Right middle fourth phalanx. They are both correct. They are both correct. In this case here, it doesn't really matter, if you put the middle first or the fourth first or the number four, it's all good. Both of those answers are correct. Okay. Does anybody have any questions about how to name the phalanges? You know what the good news is? Is that this is exactly the same way that you're going to name the phalange of the toes, of the feet. Okay? No difference. All right, moving on. Let's now talk about the pelvic girdle, also called the hip girdle. And guys, I want everybody's attention here because there's confusion that I've seen in past exams. The hip girdle are made of two bones, what we call the hip bones. Now, the hip bones have several different names, so don't get confused. The hip bones are also called coxa or coxal bones, ossa coxae, for the sake of simplicity. Simply call them hip bones. That's it. They are the hip bones. And we have two of them. One on the right hip bone, and we have the left hip bone. Okay? Now, the thing is that the hip bones, during the process of evolution, they're actually made of three bones that fused with one another. Just like the sacrum, it is a vertebra that fused together. So in the hip, these are three bones that fuse with one another, what we call the ilium, the pubis, and the ischium. But you don't really need to know this for the exam because the markings do not belong to the ilium. It does not belong just to the ischium. It does not belong just to the pubis. It is the marking of the hip bone, either the right hip bone or the left hip bone. So let's take a look here at some of the markings that I want you guys to know for the exam. One of those markings is actually a little piece of cartilage that belongs to both hips because it's right there in the middle. This is what we call the pubic symphysis of the hip. And this pubic symphysis, guys, is a little piece of cartilage that is very important when a woman is giving birth to a baby, vaginal birth. Because when the big-headed baby is passing through the birth canal, the pubic symphysis will stretch. And as the pubic symphysis stretch, it allows for the passage of the baby. And then after birth, the pubic symphysis go back to normal. Sometimes it tears and you need to surgically repair it, but it just goes back to normal. Okay? Another marking that is very important that I love asking questions in the exam is this surface, this curved surfaces right here on the hip. And these surfaces, they look just like the glenoid cavity of the scapula. These are what we call the acetabulum. So what is the acetabulum? The acetabulum is a surface that is covered in articular cartilage because the head of the femur will attach, will articulate with the acetabulum of the hip to form what joint, folks? Our hip joint. Okay? Now, what if I was pointing to this marking here and today's the exam? How would you answer that? You would say acetabulum, left hip. So we have the left hip, we have the right hip. Another important marking that I love asking questions in the exam is this big foramen right here, this big oval hole. This is what we call the obturator foramen. And it's called obturator because there's a nerve coming here from the pelvic region and passing right through this obturator foramen going into the legs. So if today was the exam and I was pointing to this marking right here of the hip, you would say obturator foramen, right hip. Okay? Can anybody tell me this is a VIOL of a single hip from a lateral VIOL? Can anybody tell me if I'm looking at the right hip or the left hip? Let me give you a clue, okay? The pubis right here has an anterior aspect, meaning that it's facing forward. Let's see here. Yes, that is absolutely the right hip, Skylar. That is correct. So that would be the right hip, okay? So we can see here a little bit better both of those markings that I mentioned in the previous slide. We can see the acetabulum of the right hip, and we can see the obturator foramen of the right hip right there. Any questions, guys? Hang in there, almost there. All right, moving on now. Let's talk about the lower limb. And in the lower limb, we have the femur in the upper leg. And as I mentioned earlier, the femur is the heaviest, strongest bone in the body. Remember, do not call it the thigh bone in the exam or the quizzes. Okay, I want you to call it the femur. Now, the femur, just like the humerus, they have several different important bone markings that I want you to know. In the proximal end, we are going to find the head of the femur, which is this round surface right there that is covered in articular cartilage and will articulate with the acetabulum of the hip to form our hip joint. Every time that we have a head of a bone, what else do we have, folks? We have the neck of the bone. So it's the neck of the femur. Specifically, this is the right femur. So it is head right femur, neck right femur. And then there are two bumps that serves as a point of attachment to ligaments and tendons. And these are what we call the trochanters. And we have the greater trochanter right here. And on the opposite side, we have the lesser trochanter. The greater trochanter has a lateral aspect. The lesser trochanter has a medial aspect. In the distal end of the femur, we are going to find the condyles, and we have two of them. And both of these condyles are covered in articular cartilage because they are going to articulate with the tibia to form our knee joint. So we have the medial condyle, which has a medial aspect, and we have a lateral condyle, which has a lateral aspect. Okay, we're going to see in a minute that the tibia, folks, also has medial and lateral condyle. And this is why it's so important when you're naming a bone marking to give the name of the bone as well. Let's say you are a doctor, you are an orthopedic doctor, okay? And one of the doctor that was looking at a patient wrote down his note. It says, okay, the patient has a fracture on the right medial condyle. You, as the good doctor that you are, because you took my class, you're going to say, what an idiot. Which medial condyle, of the femur or the tibia? okay? Because we're going to find the medial and lateral condyle on both bones. That's why it's so important to give the name of the bone as well. Now, can anybody tell me, this is an anterior veil. Can anybody tell me, is this the right patella or the left patella? Are we looking at the right knee or the left knee? Anterior veil. Let me give you a clue. The fibula has a lateral aspect. The tibia has a medial aspect. Any guesses? Yeah. Yes, right again, Vanessa. This is the right knee. This is the right patella. Okay. Moving on, let's talk about the tibia and the fibula now. And as I mentioned earlier, the tibia has a medial condyle and a lateral condyle, and they will articulate, folks, with the medial and the lateral condyle of the femur, okay, forming the knee joint. In the distal end, I want you guys to know the medial malleolus, which belongs to the tibia. So this is the medial malleolus right tibia. And then we have another malleolus called the lateral malleolus, but this is the lateral malleolus of the fibula. So it's lateral malleolus, right fibula. Guys, if you take your hand right now and you feel the two big bones to the side of your ankle, the two big bumps right there, you are touching the medial malleolus of the tibia and the lateral malleolus of the fibula. Okay? What are they going to articulate with, folks? They are going to articulate with the talus. They're going to articulate with the talus of the foot right here. As you can see, the talus looks smooth, right? Because it is covered in articular cartilage. And they are going to articulate with the medial and lateral malleolus, forming our ankle joint. Guys, the talus, it belongs to what we call the tarsal bones. And I don't want you guys to know most of the tarsal bones, like I don't want you to know most of the carpal bones, with the exception of two. What two? I want you to know by name the talus, and I want you to know by name the calcaneus. Okay? Moving on to the sole of our feet, and the sole of our feet, we're going to find the metatarsals, very easy to name. They are numbered 1 through 5. So we have number 1, right metatarsal, number 5, right metatarsal, and then the toes, the phalanges, have exactly the same format as the phalanges of the finger. They are numbered 1 through 5, with the number 1 being the big toe. And the big toe, the number 1, only has a proximal and a distal, while the other 4 has a proximal, middle, and a distal. Okay, and we named them exactly how we named the phalanges of the fingers, the hands. Guys, any questions, anything at all? All right, we just went over half of the exam. Okay, and next week, Wednesday, we're going to go over the other half. Don't wait. You need to study, study, study. Otherwise, you will not do well on the first exam. Today, we have 3 in-lab activities. Both of those, all of these activities, they are related with Lab 5. FYI, there is no activity for Lab 4, but the activities for Lab 5 is going to count points for both Lab 4 and Lab 5. Okay? There are 3 videos on Edpuzzle. And those videos are very important because they're going to walk you through a model of the human skeletal system. One of the videos is going to walk you through and show you the bones of the axial skeleton. The other video is going to walk you through the bones of the appendicular skeleton. And then the third video is going to walk you through some important bone markings within the skeletal system. After you're done with all three videos, you're going to jump on Lamaku. And remember, today there are 2 quizzes that are open. Quiz for Lab 4 and quiz for Lab 5. And after you're done with both quizzes, you can just log off the call. We are done for the day. Are we good? All right, guys, let's get started.